Deoxyribonucleic acid DNA is the biological blueprint that regulates the production of proteins, which in turn create and maintain our cells. Genes are different segments of DNA that are responsible for this formation. Each individual is one of a kind because their DNA, which is inherited from their biological parents, has minute variances. In addition to affecting physical characteristics and personality, these genetic differences also affect health, notably on mental health. These problems can have a substantial impact on how we think, how we feel, and how we deal with life. Certain mental disorders are linked to particular genes, in addition to biological and environmental factors. These genetic variances can play a role in determining an individual's vulnerability to specific mental health diseases. Even though the majority of mental health disorders, such as anxiety and depression, are caused by a combination of life events, environmental variables, and genetic variants. The vast majority of genetic changes, on the other hand, do not trigger mental diseases directly. On the contrary, they affect how genes are expressed throughout a person's life, which can contribute to the development of diseases such as anxiety and depression. Rare genetic variants, despite their rarity, have been shown to raise the likelihood of developing mental health issues. If you or a member of your family contains such variants, seeing a healthcare provider can assist in determining the potential dangers associated with these characteristics. Understanding the potential effects that genetic diseases may have on you or your family can be facilitated through the utilization of genetic counseling. During a consultation, a geneticist or genetic counselor will collect your personal and family medical history to determine whether or not you or a member of your family may have a genetic susceptibility to specific disorders. In addition, they can provide guidance regarding whether or not genetic testing may be advantageous, particularly in cases where a hereditary disorder is suspected. The usefulness of genetic testing in predicting mental health issues is still very restricted, even though it is sometimes undertaken during pregnancy or after birth to screen for particular illnesses. At this time, genetic testing is not capable of accurately predicting whether or not an individual would acquire a mental health issue. Even though the bulk of the genetic markers that have been identified up to this point only minimally increase the risk, ongoing study continues to investigate how genetics contribute to mental health. Even though the identification of particular genetic markers that are connected with mental health diseases may someday lead to enhanced screening and individualized treatment, genetic tests are not yet a tool that can be used to diagnose or treat mental disorders. On the other hand, clinical genetic testing, which is frequently requested by medical professionals, is intended to identify the likelihood of developing diseases, such as cancer, but it is not particularly useful for predicting mental health disorders. These tests are often geared toward identifying certain genes that are associated with particular disorders, and they are primarily utilized for those who are at high risk for rare genetic diseases. Direct-to-consumer genetic reports, on the other hand, are available for purchase from a variety of companies and include information about genetic abnormalities that may be related to a variety of health hazards. However, these reports are not equipped to properly predict mental health outcomes. The interpretation of direct-to-consumer tests should be approached with caution, particularly when it comes to mental problems, because they are not accompanied by the assistance of a healthcare expert. The evaluation of your mental health risks can also be greatly aided by having a thorough understanding of the medical history of your family. There is a correlation between having a family member who suffers from a mental health illness and an increased likelihood of developing a mental disorder yourself. On the other hand, it is essential to keep in mind that genetics is only one component of the equation. Environmental circumstances also play a considerable impact. By having conversations with your relatives and maintaining a record of your family's medical history, you and your healthcare practitioner will be able to have a better understanding of the potential dangers and take preventative measures. Furthermore, clinical trials are an essential component of research in the field of mental health. To enhance our understanding of mental diseases and develop therapies, these clinical trials, which investigate methods to prevent, detect, or cure a variety of health conditions, are necessary. There are many different motivations for individuals to take part in clinical trials. Some of them are to contribute to the advancement of scientific knowledge, while others are to gain access to new therapies that are not yet generally available. Although there is no denying that genetics affects mental health, it is simply one piece of a much larger and more complex puzzle. The mental health outcomes of an individual are shaped by the interaction of several factors, including genetic influence, life events, and environmental influences. Even though great progress has been achieved in discovering genetic markers that are related to mental diseases, the present understanding of how these markers affect mental health is still limited. Genetic testing is not yet a definite method for predicting or diagnosing mental health illnesses. Nonetheless, the promise of genetic research offers hope for future advances in screening, prevention, and therapy. Nonetheless, for the time being, genetic testing is not a definitive instrument. Individuals must approach mental health from a holistic viewpoint, acknowledging the significance of personal experiences, environmental circumstances, and the history of their families. It is possible to gain significant insights into potential hereditary risks by consulting with healthcare experts and genetic counselors. In addition, clinical trials and continuing research continue to increase our knowledge of mental health. In the end, the path to improved mental health is not just determined by genetics. It also involves seeking the advice of professionals, gaining knowledge of one's personal history, and being open to the ever-evolving scientific research that underpins mental health care. By doing so, individuals can take preventative measures to safeguard their well-being and traverse the complexity of mental health with increased clarity and self-assurance. Don't forget to like, subscribe, and drop a comment below. We'd love to hear your thoughts and stay tuned for more content.